There could be a situation where you go to your doctor for a routine evaluation to see how your health is going. After your examination and a couple of tests, he declares that your blood sugar is normal, but you are suffering from diabetes. Would it make a sense to you? Actually, it does. At least in some of us. Watch this video till end to understand more about this tricky situation to diagnose both for the doctor and the patient. Most of us think that diabetes mellitus is a disease when your blood sugar or levels of glucose in blood is higher than an expected value, which of course has changed its cutoff many times in the past. Actually, diabetes mellitus is derived from the Greek word diabetes meaning siphon to pass through and the Latin word mellitus meaning honeyed or sweet. It was described as a disease when someone starts passing a sweet urine. Sushrata, in 6th century BE, an Indian physician identified diabetes and classified it madhu-meh, where the word madhu means honey and combined the term means sweet urine. The ancient Indians tested for diabetes by looking at whether ants were attracted to a person's urine. Later it was found out that presence of glucose in urine correlates well with the levels of glucose in the blood. If kidneys are functioning normally, a level more than 180 mg deciliter will lead to leakage of glucose in urine, showing its presence by a simple dipstick or a laboratory test. But most of us fail to understand that a raised blood glucose level is not the definite indicator of diagnosing diabetes. Diabetes is a hormone disease due to abnormal insulin levels. In type 1 diabetes, it's very low or insufficient insulin production from pancreas, and in type 2 diabetes mellitus, it is increased production of ineffective insulin from pancreas. The high level of ineffective insulin in blood leads to its complication of damaging our body cells of liver, blood vessels, heart, eyes, nerves, kidneys, etc., leading to multiple disease syndrome typical of diabetes. But of course, insulin was discovered in year 1921 only, since it is cumbersome, requiring special equipment and also not cost effective to measure insulin level in individuals suspected to have diabetes. Blood levels of glucose were used to diagnose and monitor diabetes. However, this measurement of blood glucose has its limitations, as is true with all proxy indicators, also known as an indirect indicators. It's an indirect sign or measure that can approximate or can be representative of a phenomenon without a direct measurement, as is insulin in our case. This approximation is not error-free. Many cases of diabetes with still normal blood glucose levels will remain undiagnosed. However, the graph of the natural history of type 2 diabetes shows that it takes many years of abnormally raised insulin levels before it manifests into hyperglycemia or a raised blood glucose levels. It means that diabetes with its complication had risen much before blood glucose started rising. By the time blood glucose is high, many tissues of patients are already affected. Is it that our fixation on blood sugar levels to diagnose and monitor the control of diabetes is greatly suboptimized? This fixation also creates an illusion that if after treatment blood glucose levels are normalized using drugs and other modalities, diabetes is fully under control. Maybe we are still in a phase where high insulin levels are damaging our organs silently. If you feel that you have learned something new today, I request you to kindly press the like button, subscribe this channel and comment.